representatives of UNDP, representatives of the Ministry of Health of Sierra Leone, distinguished researchers and academics, technical and financial partners, representatives of the ECOWAS member states, ladies and gentlemen, members of the press. On behalf of the Director General of the West African Health Organization, we would like to thank you for associating us with this important inception meeting for the project supporting and strengthening sub-regional post-Ebola medical surveillance and socio-economic recovery initiatives in West Africa. Distinguished delegates, the Ebola virus disease outbreak in the 3 West African countries, Liberia, Guinea, and Sierra Leone, which occurred in March 2014, has been reported to be the largest, most complex, and perhaps the worst the world has ever seen. More than 28,000 people were reported to have been infected with the virus, with over 11,300 deaths occurring in Guinea, Liberia, and Sierra Leone. The disease devastated and desecrated families and communities in the West affected countries, stretching already weak health systems to their limit and bringing untold hardships to millions of people. Indeed, the Ebola virus disease was a wake-up call to a world that at first appeared unconcerned until fatalities were recorded in Europe and the US. The international response, albeit late, was massive and perhaps initially chaotic. There was unjustifiable knee-jerk reactions, irrational speculation often born out of bad science and scaremongering. But at the same time, a rare display of humanity unprecedented in the modern history of the ECOWAS region. Despite the ensuing border closures and suspension of airlines, the humanity demonstrated during the crisis gave meaning to the brotherhood of man and prevented the sovereign nations of Liberia, Sierra Leone, and Guinea from being cut off from the rest of the world. Mr. Chairman, it is in the midst of this confusion and perhaps desperation that the Director General of the West African Health Organization took what may probably be the most difficult decision of his career by opting to put on the front line WAHO staff who had previously not been trained for an intervention of such nature before the institution could mobilize the required health personnel to the affected countries. This was a mark of real leadership that has earned the institution commendations from the African Union and other international institutions that worked alongside us during the crisis. Permit me also to salute the huge role played by the former president of the ECOWAS Commission, Mr. Kadiri Ouedraogo, and the president of Togo, His Excellency Zosima Yasimbe Yadema, who was appointed by his colleague heads of state to oversee the response and elimination effort. Mr. Chairman, there are some useful lessons to be drawn from the Ebola outbreak. The first, that a country's ability to respond effectively to an epidemic of such magnitude is a function of the robustness of its health system. Second, that community engagement is crucial in such situations. And finally, that working together we can bring hope and comfort to a broken world. It is for this reason that WAHO endorses this Japanese government-funded UNDP initiative aimed at supporting and strengthening sub-regional post-Ebola medical surveillance and socio-economic recovery initiatives in West Africa. This is consistent with WAHO's objective of working with our financial technical partners to support the ECOWAS member states to combat epidemics, with the establishment of the ECOWAS Regional Center on Disease Surveillance and Control. We therefore remain committed to working with all of you, particularly the Nguchi Memorial Institute for Medical Research in Ghana and the UNDP, to ensure the success of this project. Thank you, and may God guide our deliberations.